Hi everyone, you're listening to Achieve Balance with Dr. Arminta, a show brought to you to help you be healthier, happier, and more vitalistic next year than you are this year. You can find us at achievebalancechiropractic.com/podcast. And you can find us on Facebook as well. We are looking forward to helping you be healthier in your future. Thanks for listening. Now let's start the show. All right, guys, welcome back to another episode of Achieve Balance with Dr. Arminta. I will have with me today a beautiful sacred woman in our community when it comes to helping you birth your children. And we're going to talk about home birth, the safety of home birth, her experience. Her name is Dawn Finney. She is a local midwife here in town. And I am honored to be able to give an interview because I've watched her do her thing, and I know the moms that have had amazing experiences with her. And so welcome to the show, sweetheart.
Thanks for having me today.
Oh, yeah. Absolutely. Okay. So tell us what got you into midwifery and what the draw of the passion is.
Sure. It's not my background at all in terms of like what I was training for in my life, but when I gave birth to my son, I was living in Iowa City, Iowa. And I was working at the university hospitals and clinics in a web designing sort of capacity. And I got pregnant after I got married, and I knew that they had nurse midwives. So home birth was not on my radar yet, but I knew that they had nurse midwives, a couple of them through the hospital, and I decided to engage them for my maternity care. And so during the birth of my son, I really liked the compassionate care that I received from my nurse midwife. Her name was Ann Peacock. And she was with me the whole time. She would come and spend time with me and support me in my labor, and then she delivered my baby. And I just remember at some point in the postpartum care, looking at her, not only did I appreciate her care, I just think having a baby is an amazing transformative experience in a woman's life. It really shook me to my core. I felt like a goddess. I felt amazing. And even my birth didn't go as I had planned it to go. I was planning an all-natural birth, and I ended up needing an induction with Pitocin. When I managed to get through most of it, I had like a little bit of Nubane for pain relief, which if you've had that, it doesn't really help all that much. But I gave birth vaginally after a very long labor that was induced. And I just felt like this is so amazing. This is just a transformative experience. So in the course of my postpartum care, I remember looking at Anne and just the thought popped into my head, I need to be doing what she's doing. It was like a voice from someplace else. So I need to be doing what she's doing. And so that's what started my interest. And then in between my children, I started to think about how might I do this. And I did learn about the fact that you could have your baby at home with midwives that were especially trained to do home birth. And so that's what I pursued with the birth of my second child. And in between those times, I became interested in training as a midwife, but there wasn't anybody in the area who was taking any apprentices in order to train as a midwife in this more traditional way. So I just said, no matter what, I'm going to do this one way or the other. So I just decided to start taking some prerequisite classes for our nursing degree. And so I got started with that because I was going to do it one way or the other. And got into that, so I was going to classes when I was pregnant, and I also had a full-time job, and I was a mother. It was a really busy time in my life. And I had my daughter at home with midwives, and that went really beautifully well. I didn't have to be induced that time. It was super, super great to just have that kind of start up naturally. And then, so carried on with my classes, and then about a year later after the birth of my daughter, a woman moved to town. Her name was Molly Rabach, and she is an American woman. And she had been spending the past 5 years in Russia. She had studied the Russian language and had a Russian husband. She had started this internship program called the Russian Birth Project. And so after having done that for 5 years, training North American students of midwifery in the Russian maternity hospitals, she decided to take a break and come to the U.S. and live where her family was for a while. So by that time, I'd gotten involved with my local midwifery organization, and she and I met each other, and she was sort of available to be a teacher, and I was looking for a teacher, and so the two of us joined together, and she took me on as her apprentice, and I studied and practiced with her for the next 4 years. And in that last year, I completed her internship program, the Russian Birth Project. So in 2002, I went to St. Petersburg, Russia, and worked in the maternity hospitals for the summertime there, and had that experience, which is very interesting. And Molly, just being a Russophile, really loving to live in Russia, she decided to stay in Russia. I returned to southeastern Iowa and Washington, Iowa, where we were living at the time, and I basically assumed her practice in the southeastern area of Iowa, which also involved a lot of Amish people because it's very close to Kelowna, Iowa, which is a center, like the largest Amish settlement west of the Mississippi River. So there we lived for the remainder of the years that we stayed in Iowa, and I had my own private practice. And then in 2011, we moved to the Columbia area, and then I got going here as well. So I've been practicing in Missouri ever since.
Oh, that's
so that's
awesome.
Kind of like in a nutshell my story.
That is wonderful.
And I am what's called a certified professional midwife, and I'd love to explain how that's different than...
I would love to know how
exactly,
that's different.
It's people and they're searching.
Mm-hmm.
There's a few credentials. There's a certified nurse midwife, certified professional midwife, and there's also what's called a certified midwife, which is only available in certain states. So a certified nurse midwife is someone who's gone through nursing school, and then they get a master's degree in nurse midwifery. And from that point on, they're generally going to be working in hospitals because that's what the credential allows them to do. Some will have home birth practices. Some will also get the CPM credential, which in some states allows them to practice as certified professional midwives in a home birth setting if there are restrictions to nurse midwifery being able to practice in the home setting. Certified professional midwives are what more people think of as traditional midwives, and our education comes from a more apprenticeship style model, although the credential has evolved over the years to include like brick and mortar schools or long distance programs from which then you go get clinical experience either at birth centers or with a senior midwife somewhere. And so we need to get a certain level of experience. We have to have attended a certain number of births in 3 different stages: observer, assistant, and then primary under supervision. After we qualify for all of the experience that we need, then we need to sit for a written exam. Of course, we have to fill out a lengthy application process and then sit for a written exam. And after that, we have to qualify. If we pass the exam, then we have to get a skills exam. So a huge booklet of skills that we have to get checked off of, and then the skills are demonstrated as part of the exam. And if you pass that part, then you receive the credential from the North American Registry of Midwives, which is the credentialing body that offers this national credential. And we have to renew it every 3 years. We have to keep up our CPR and our neonatal resuscitation training. We have to have peer reviews and continuing education credits, much like everybody else with a professional credential, which is maybe something people don't realize. That it's not just reading a couple books and hanging out a shingle. This is a serious credential that involves training and study and knowledge and skills.
Super lengthy super lengthy training because you have to apprentice for 4 years. You said.
Well, I did.
Oh, you did.
You know, it takes as long as it takes to get the experience that you need, and it has to be done within a certain time frame, or else the births that you've attended start to drop away, and you need to get new ones. So I mean, it's not like you can string this out. It needs to be in a concentrated fashion. Okay. So it's a rigorous credential, and I'm glad to help people understand that because I think that not everyone understands that this is actually quite involved in the training process. And you've continued,
you have practical examination, then you have continuing education that you have to continue to work on. And absolutely. It is one of the most misunderstood, just people don't talk about it. It's not, it's starting to become a lot more conversational, having home births and looked at as like this is an option. And that's why we're doing this podcast. Is the biggest thing is to let individuals understand that they have options,
absolutely,
and natural options when it comes to how they would like to approach their birth, because all births are different. From none of there's not a birth that's going to ever be the same. And how do you want to have your environment for your birth? And so how long have you been actually out of apprenticeship doing midwifery?
I've been training, I trained for 4 years, and then I've been in practice for about 15 years. So like going to births in the birth world for a total of 19 years, but so 15 in a private practice in Iowa and in Missouri as well.
Wonderful. Now, what's your favorite part about what you do? I mean, what did you do? You get to witness miraculous things.
Because I view birth as such a transformative experience. It's a rite of passage into motherhood for those who choose to birth a baby in this way. And again, that happens no matter, even if there's a C-section, you are still a mother, you still gave birth. I mean, there's no judgment about how that happens. I just feel that supporting women in this journey in a way that's respectful and allows them the ability to recognize this as a physiologic event. I mean, of course, it needs some care and watchfulness and measures of safety. But to help women have that experience with someone who is trained to watch out for any problems that might happen allows them to do this journey on their own. To me, it's epic, it's mythic, it's huge. And I see women just pull from amazing resources within themselves to have an unmedicated birth. And so the ability to support that process, as well as when the baby comes out, to support the baby's physiologic transition from being a womb dweller to being earthside is amazing too, and handling babies in a respectful way and putting them onto their mothers, or being able to help them get started breathing if they need it while they're on their mother. I mean, those are, so being a guardian of this journey to me it's just so important. It's work that's, I just feel drawn to do. The other thing I really love about midwifery care is that this is a more technical, clinical sort of element to it, but it's, this might appeal to the nerd in all of us or whatever, but I love that midwives can respond to emerging evidence in a quicker fashion than hospital obstetrical departments can. It takes decades sometimes for those policies to change.
Very much so.
I'll use for an example cord clamping. So that's just a small thing, but we know that there's a huge benefit to allowing the transfer of fetal blood from the placenta to the baby, and there's this sort of pressure gradient that happens through the cord, and the cord will shut down naturally on its own, and the baby will get the blood it's needed. So, but it's been a practice for a long time, and it is beginning to change in the obstetrical world that, for years, babies' cords were clamped immediately, and then you can create a situation of shock for the baby when a third of the blood volume is not transferred to the baby, and then they can't keep their temperature up and all these different things, or they're anemic down the road. So research has supported the practice that midwives have done for a very long time of just allowing the cord to shut down on its own and clamping and cutting when you can tell that it stopped functioning. And now in hospitals, they're just beginning to do this. Again, consumer demand is important, and so women are asking for this and doctors are responding, and that's great. But I still see this sort of hesitancy to, like, it's just this 30 seconds of agony waiting to okay, we'll let that pulse and then they clamp, but it's still not really it's not fully done yet. I mean, you can let it wait a long time. It doesn't have to be rushed into it. So it still isn't quite delayed cord clamping the way I would call it. But again, so that's emerging.
And from my understanding, you want to let it not pulsate. Is that correct? Is that
you want to just let it finish functioning fully.
Right.
So, and it'll be like limp, wet, soft thing that you can clearly see is done functioning. And so that's the time to clamp and cut, really. Another thing is the way resuscitations happen. If a baby is born and needs a little help, again, that cord is clamped and the baby is taken to a warmer across the room. You've just taken oxygenated blood away from a baby. What midwives do is we just have the baby right there next to the mother and resuscitate with that cord attached. Again, the evidence is emerging to support what midwives have always done in these ways. So I just like that that's something we can respond to. We can respect the physiologic happenings of birth and babies being born and their adaptation to life outside the womb in a way that's physiologically sensible, and not artificially, like, we
not
have to
necessarily
adapt to the warmer.
Procedure. It's a process.
Right.
You have to let the body do what the body does. Just like looking at your Facebook page, we had a beautiful video on there of a home birth and just the rawness of it, because there's very beauty to allowing yourself to fully express who you are while you're going through that transitional stage into motherhood, or regaining that sacredness, but also looking at how we time births, and in terms of if you're 40 weeks, that means you're overdue. Let's hurry this along. And what my favorite thing of looking aerially above what you do and not knowing exactly what you do to the fullest capacity is that you are there to assist, and you let nature take its beautiful course the way that it's intended to, and just are there to support, encourage, and know that if we do need to intervene, when we need to do all of that.
I'm not anti-intervention, but it's more about using it when it's needed, not when it's not needed. So I think what can go wrong is when interventions are applied to an otherwise normal pregnancy and normal labor process. And I think that's what drives women to choose home birth, is that they fear that their births are going to be taken over by hospital policies and being hurried along, or things are going to happen, or they're going to feel pressure to induce when maybe it isn't truly medically necessary. They're going to have to battle that out and not feel supported in a hospital environment, saying no to things that they didn't really want.
Right.
When there's no medical, again, if there's no medical indication that those are necessary.
Now, for those that are listening that don't know, what's it look like to have a home birth? And we know that all births are going to be different, whether in any setting that they're in. But what does it look like to have a home birth? What's that whole process look like? Do I still go to my OBGYN appointments, or do you check me on all of those aspects? And what does it look like if I want this as an option and a more natural approach to giving birth?
So I'm pretty open to whatever care plans people design for themselves. Certainly I take care of women from the very first prenatal all the way through labor and birth and postpartum, but some women do receive some care from their family practice doctors or their obstetricians, or they might begin care and then transfer to me, or if they need to see somebody later on, or if they want some of this covered by insurance, they can see some of the physician care for that reason. But I can provide everything that is needed, or access, ultrasounds through a physician in town, or order the blood work and the different lab things that we need, like groupie strep test, all that kind of stuff. I can get all those things for everybody. So there isn't necessarily the need to have an extra physician involved unless somebody wants that. And so when women go into labor, we stay in touch by telephone, and I arrive when it's time to be there, which is usually about the time a woman is into active labor and the contractions more intense. Throughout labor, we monitor a baby's heart rate with a Doppler. We have a protocol for listening quite regularly. This is how a baby communicates his or her well-being to us, is through the fetal heart rate. So we stay in touch with that. As appropriate or necessary, I offer to check the cervical dilatation, and again, with permission always. My question in that case is, do we need that information, and what are we going to do about it? So applying those kinds of criteria, and so I'm not just checking just to check. We want to know where are we starting from, and are we making progress, making sure that those things are happening. And sometimes if it's not the first baby or things are moving very quickly, you can kind of just tell that things are getting out of the way, if the pushing is really happening spontaneously, and you can just tell that the baby's moving down well, or the mother is telling you that it is. Sometimes we get through a birth, we don't even really need to check much at all.
Right.
And again, birth happens in any position that the mother wants. We encourage movement in labor, light eating and drinking, staying hydrated, use of water. There's just a lot of freedom for women to find what helps them move through birth as well. And we stay with them. We are there in the home the whole time. We offer support, verbal encouragement, physical comfort. Some women like to get their backs massaged or pressed on, and we don't waltz in at the end to catch a baby. We are there the whole time supporting women through that process. And lots of verbal encouragement, or sometimes silence. If a mother wants silence and privacy, that's a great thing to be able to offer. So we'll just tiptoe in and listen to the baby when we need to. But if that mother really wants that privacy, which is and it's in the comfort of her own home, so she feels it's a familiar and safe environment that helps her really relax into her labor and let go, and that's a big part of labor. And then the baby comes out, baby is born, and baby, if all is well, baby goes right on the mother. If we need to resuscitate, we're ready to do that as well. And then we are waiting on the placenta. We're monitoring, making sure there isn't much bleeding. If there is, we're going to be addressing that with either herbs or the medications that I carry to address hemorrhage or big bleeds or whatever. And we're making sure the baby is transitioning well. And in that first hour, the baby is just on the mom. And whenever the baby indicates a willingness or readiness to nurse, we help the baby get to the breast. And within that 2-hour time frame, deliver the placenta, make sure everything is stable. And, mother is in her own bed or at her own home, wherever she is, she's comfortable. And within the 2 to 3 hours that we're there, we're going to be doing a thorough newborn exam, weighing and measuring and assessing the baby's well-being and physical body and everything like that. If the mother has torn, we're going to assess her tear and do a repair if necessary. I carry medication and equipment to suture tears. We make sure that she has eaten, she's used the bathroom, she's cleaned up, and everybody's stable before we go home. And then all the postpartum care is also in the home, which is lovely. And so this is, I think, a big gap in Western medicine in general, is the postpartum for women. So when women are released from the hospital, they are not seen until 6 weeks. unless there's a problem, and then a woman has to put herself in a car and go someplace and get checked out. So by the time a woman recognizes it's a problem, it's been probably brewing for a while.
Right.
So I provide a bunch of postpartum visits in the home, checking the mother as well as the baby, making sure baby's gaining weight, that breastfeeding is going well, baby doesn't look too jaundiced, things like that. But also the mother's well-being is so important. I feel like that is a huge gap in care right now. I think other countries do a far better job of providing postpartum care and support toward mothers. And breastfeeding support happens in the home, so she's in the location where she breastfeeds. She's got all her pillows and props and things that are ready to use. It's really a different experience to help a woman breastfeed at home versus trying to support that in an office location.
Oh, absolutely.
You know? So, because again, she's just in her environment where she's normally going to do it. She's in her bed or she's in the special chair that she uses. So, again, all the postpartum, like the birth, we do spend a lot of time on pregnancy and labor and birth, but then the birth is the start of everything else, and that needs a whole other degree of support that I think is truly lacking in general care.
And I think that it gives an opportunity, especially for new mothers and first-time mothers, an opportunity to have very much safety and personal encouragement. Because as a new mom, you're like, am I doing this all right? Am I is this what I'm normal and what I should be expecting? And if you have 6 weeks before you are even checking yourself out, do you even know if something's wrong? Or is that just, I should just expect that because I just gave birth and it's probably just totally normal, when it could be not. And to have somebody to bounce that off of and to know if you need to do anything to, troubleshoot a situation per se.
Right. To catch the issues before they become true full-blown problems. Catch them early and take steps to manage those things, and making sure that mothers are resting adequately, because part of prenatal care is to prepare for the postpartum and making sure that women have lined up support and family and meals coming in from their community, or if we need to get a more experienced lactation consultant in to help us, that we're doing that as well. So we pull in the resources that are needed and hooking them up with here's someone who specializes in postpartum doula support, or finding whatever it is that they need.
You're taking care of, we're sharing a client right now, and this is second home birth for her, and the referral that you just gave for some pelvic floor support, it just is really just making sure that all bases are covered, pre, post, and you're really looking out for not only the baby but the mom for the long haul, and encouraging the whole experience that they're having, and not only that experience but post that experience and the transition into the next step and the next phase of this journey called life, and it's a powerful thing. Now, another thing that you do that I do want to talk about, because I think that it needs to be spoken about, and a lot of people get really is the placenta encapsulation that you do. And so the placenta is so full of vitamins and minerals and nutrients that it's so important. And tribally speaking, they used to dehydrate the placentas or eat them in general. And some people really get a little quivery talking about that, but you can take the placenta and actually make capsule supplementation out of it.
It's dehydrated and ground and then put into capsules for women who are interested in using it as a supplement after the birth.
Now tell us the benefits of that you've noticed.
Sure. Well, I have never had anybody call me and say, well, I didn't do anything, or I didn't like the way it made me feel. So, I haven't had any reports like that, so I think that's good. The benefits are said to be that it's extra nourishment, it's full of iron, and that it helps the hormonal transition after birth, because so much of the hormones just kind of drop away or they change so drastically. So the hormones that the placenta contains are said to just even that out a little bit for women, especially if a woman has dealt with postpartum depression. So I think that is the key thing that women are looking at, using the placenta as medicine to help with is the emotional transition after birth. Right,
and that can take a woman and just tailspin her, because it's really just a chemical reaction that's taking place. And when you have that much of a drastic change in those fluctuations, it can really throw all systems off.
Right. Plus, you are talking about a sleep-deprived woman who her body is sore, her bottom might be really sore, her nipples might be sore, And so there's an extra stress in that way. And so again, the support, the postpartum support, and like having family or friends to help is so important. And just having some nutritional support in that way with this powerful organ that can address those issues is helpful.
That's wonderful. Mm-hmm. And then you have an apprentice with you now, or an assistant.
Yeah, her name is Katie Miller, and she's lived in the Columbia area for about 10 years and has done a lot of doula work in the area.
Good.
And so she's enrolled in the Midwife's College of Utah, which is a school that she does her book learning through. And then she has done some clinical work at a busy birth center up in Wisconsin that served Amish families. Mm-hmm. And then she's getting additional clinical experience with me as well.
Wonderful.
So she's getting toward the end of her training and will be able to complete her all the criteria that she needs to be able to apply for the credential and then sit for the exams in the not too distant future.
That's wonderful.
Yeah.
That is wonderful. Well, anything else you want to add to our listeners and tell them more about what you do and how you do it?
I think it's also just it's always something to be said that, I think what's important about birth in general is being flexible and having a flexible mindset and being responsive to whatever a birth needs. And I do like to, I have made some statements that sound a little critical of Western medicine and hospital care. And I think it's good to look at with practices with a critical eye and say, is this evidence-based or not? But I would say that it isn't ever home birth at any cost, at any price. It's not just like we just keep people at home indefinitely. If there is a need for help or a labor that's not progressing, or we have heart tones that are not sounding good, my goal is to practice safely and have good outcomes for mothers and babies, just like everybody else wants as well. So I have no problems transporting a mother to a hospital for the extra help that we might need. And I'm so grateful to the medical community who accepts home birth transports. I feel that my clients and I have been treated very respectfully when we've gone into the hospital, Women's and Children's in town, which is a great resource for us. And also I appreciate the different physicians in town that work with us that help provide ultrasounds and consultations when needed. So that is what makes home birth safe, is when you have a number of practitioners at different levels that a woman can access for her care at the time that she needs those different levels of care. That's what makes it safe. And that's why, in Missouri, I'd like to say that, certified professional midwives have been legal since 2008. Mm-hmm. Prior to that, they were illegal. They were criminalized. It was considered, to be a midwife was considered practicing medicine without a license. Having a home birth was not illegal. You could have a home birth, but being the midwife was considered a felony. It's the same way it's currently the state in Iowa, where I used to live. It's still a felony to be practicing as a midwife. That. And I just want to say that having midwifery be legal, decriminalized, and above the risk of prosecution and that fear that keeps people underground, that's what creates a good atmosphere for women to have home birth and access midwifery care. So I'm really hope that the state maintains a legal atmosphere for certified professional midwives and will eventually license them. That's a whole other topic. But this is a very different thing for certified professional midwives state by state. 26 states have legal midwifery. A number of those states license midwives. And that's what we're trying to do here. It's just that we've kind of hit a stalemate in the state legislature.
Okay.
So, but anyway, that's I really appreciate the different levels of care that I'm able to help access with my clients to get them what they need at the time they need it.
Absolutely. And I think that that's a common question, is the what if question, and how
it's an important question. Yeah.
Absolutely.
We get the care we need for the situation as it warrants.
Absolutely. Right. And I think that, Women's and Children's, they've always been easy for us to work with and communicate with. And so just knowing and then having that keen eye of knowing, okay, we're going to pack it up and we're going to go, or we're good, you're fine. Let's just allow the process to take place. And I think that is wonderful. Well, we're going to put Dawn's her contact information in the show notes, and so you can learn more about what she does and how you can access her. If you have questions, how you can reach out to her. And then if you are pregnant, I highly encourage to at least sit down and have a consultation and a conversation to see if this is a good option for you and your family. Because if I were to ever be pregnant, I wouldn't even hesitate. It would be no doubt, if I could have my child at my home, I wouldn't even think twice about it. And,
that's the first step is contact me, and you would schedule an interview. We would meet each other in person. I work out of my home. We'd meet there, and we would just have a conversation about this care, what it looks like. Get all your questions and your partner's questions answered, and I have a packet of information that I give to everybody that covers all the elements of what care looks like and what makes someone low risk and a good candidate for home birth, and also just like the financial information as well. So, and it's a no obligation interview, and you're free to interview other midwives in the area as well. And that's the first step to deciding if this is the right kind of care for you.
Wonderful. Well,
thank you so much.
Oh, you are
Thanks for having me
so
today.
welcome.
I appreciate it.
Absolutely.
Yeah.
Thank you so much for joining us. And you guys join us on our next episode. We look forward to helping you live a healthier and more vitalistic, natural life next year than you do this year. So bless you. Have a great day. Hi guys, Dr. Arminta here. Thank you so much for listening. I hope today's episode brought you information to help you eat better, move better, think better, and take care of the true root of your health issues. You can find us online at achievebalancechiropractic.com/podcasts, and you can find us on social media as well. We look forward to having you here the next episode, and we look forward to helping you create a healthier future tomorrow.